Now, this article here would be for people at the age of Medicare. Now, why is this important? On the TV, if you turn on your TV, you see lots of ads about Medicare Advantage. So private Medicare plans misled customers into signing up, Senate report says. This article wouldn't, most people wouldn't relate to this, but however, people who are parents or grandparents and so forth, they might want to take a note of this. Companies selling private Medicare plans to older adults have posed as the Internal Revenue Service, right? Which is scary, right? You thinking it's the IRS calling you? And other government agencies. That's the way you get people's attention, when you pose as the IRS or other government official. Misled customers about the size of their networks and preyed on vulnerable people with dementia and cognitive impairment, according to a new investigation of deceptive marketing practices in the industry released Thursday by the Senate Finance Committee. Many individuals say they were enrolled in plans without realizing it. Right? The report cataloged complaints from 14 states and a multitude of marketing materials generated by the insurers and the companies they hired to help sell the private plans. The plans are part of a program called Medicare Advantage that now enrolls nearly half of all Medicare beneficiaries. The committee says people both in traditional Medicare and those already in a private plan have been inappropriately switched. It is unacceptable for this magnitude of fraudsters and scam artists to be running amok in Medicare, and I will be working closely with CMS to ensure this dramatic increase in marketing complaints is addressed, said Ron Wyden, a Democrat senator from Oregon and the committee's chairman, referring to the Centers for Medicare and Medicaid Services, the agency that oversees Medicare. Medicare Advantage offers valuable plan options and extra benefits to many seniors, but it is critical to stop any tactics or actors that harm seniors or undermine their confidence in the program. Medicare Advantage has become a highly lucrative market for health insurance, but many of the insurers selling such plans have been accused of overstating how sick their customers are, according to a New York Times review last month that found 4 of the 5 largest insurers have faced federal lawsuits accusing them of fraud. Because it is such a profitable line of business, they have an incentive to do more marketing, said Tricia Newman, a senior vice president at the Kaiser Family Foundation, who is working on a review of television advertisements by the plans. And they have more money to do marketing, which increases revenue. Most of the behavior documented in the report came from insurance brokers or third-party marketing firms hired by the companies, not the insurers themselves. The Senate report did not say which insurers benefited from the behaviors described, but it identifies similar misleading behaviors across multiple states and an escalating number of complaints suggesting that the tactics were not limited to a small group of bad actors industry trade groups denounce the practices. America's seniors and people with disabilities deserve Medicare Advantage plans that continue to deliver better services, better access to care, and better value. Christine Groh, a spokeswoman for AHIP, an industry trade group, said in a statement, "Health insurance providers are clear. Americans should be protected from bad actors who engage in misleading advertising and marketing tactics." She emphasized the federal government's strict oversight of the industry's marketing, including new rules that will require brokers to record their calls with potential customers and offer greater supervision of the third-party marketing groups enrolling new customers. The Senate report pointed to several aggressive practices that it said amounted to fraud. 5 states said they were aware of brokers that had targeted people with cognitive impairment, and 6 states indicated people were signed up for a Medicare Advantage plan without even knowing it. Marketing firms in several states send mailers to Medicare beneficiaries made to look like correspondence from the Internal Revenue Service, the Social Security Administration, or Medicare itself, the report said. The mailings are designed to generate leads for insurance brokers. Federal rules prevent cold calling of Medicare beneficiaries, but once respondents call, click, or mail back a form, the companies are allowed to call them repeatedly. See that? Repeatedly. So don't call these people back unless you're really, really sure you want to talk to them. Otherwise, that gives them the green light to just call you repeatedly until you drop dead, maybe. The investigation found similar forms from several states that look like tax documents using the font and layout of an IRS form. One Utah mailing declared, "Important, complete, and return postage paid card within 5 days." The report also said that a frequent refrain in television commercials and mailings was the idea that switching to Medicare Advantage would increase beneficiaries' Social Security benefits. Some plans do charge lower premiums than traditional Medicare, but not most. Only 7% of beneficiaries this year were enrolled in a plan that offered such a premium discount, according to research from the Medicare Payment Advisory Committee. The report described an Oregon man who enrolled in a Medicare Advantage plan after hearing that switching would increase his Social Security check by $135 a month. It turned out that his new plan did not cover prescription drugs, and his Social Security income was unchanged because Medicaid already paid his Medicare premiums. He was astonished and very stressed out when he went to the pharmacy, according to complaints cited in the Senate report. He said he was never told that and would never have enrolled in the plan without drug coverage. Of course, and I believe it. It doesn't make any sense. You reach a certain age, why would you enroll in the plan where you don't have prescription coverage? But see, they didn't tell him that. 10 of the 14 states said people were confused about whether their doctors or the drugs they were being prescribed were covered under a plan. In Oregon, a patient was switched from traditional Medicare and a Medicare supplemental policy to a Medicare Advantage by an agent who came to her house. The new plan did not include her mental health provider as part of its network. Her claims previously covered were denied. See that? A 94-year-old woman with dementia in Missouri was sold a plan that did not include the hospital or doctors she saw in her rural area, according to another complaint. She was forced to travel significantly farther for her medical care. Medicare Advantage plans have become increasingly popular. They are required to offer similar benefits to traditional Medicare, and many include extras like dental benefits, gym membership, or low premiums. But the plans typically come with limited provider networks, which means that switching plans could mean losing access to doctors or coverage for certain prescriptions. Most Medicare beneficiaries are allowed to switch plans once a year during a period known as open enrollment, which this year started October 15th and ends December 7th. That's the time of year when the advertisement mailers and telemarketers are most pervasive. Medicare has recently promised to increase its oversight this year and next, but the increasing popularity of the program and looser regulation under the Trump administration appear to have led to an increase in complaints to Medicare. The report says that complaints to the Centers for Medicare and Medicaid Services more than doubled from 15,497 complaints in 2020 to 39,617 in 2021. Several state insurance regulators have also seen an increase. In some areas of the country, confused and embarrassed seniors have fallen victim to improper marketing practices, said Ceci Connolly, the chief executive of the Alliance of Community Health Plans, who wrote last month to Senator Wyden about concerns that people were being misled into changing plans. It is very clear from the on-the-ground experience of our members that it has grown significantly, she said in an interview. Plans say members are being switched to competing insurance without their knowledge, including one plan in which a beneficiary was disenrolled 4 times before ultimately being allowed to stay. David Lipschutz, the Associate Director of the Center for Medicare Advocacy, which favors stronger regulation of the plans, said Medicare could be substantially more aggressive about enforcing the rules against deceptive marketing. Plans might try to distance themselves from the marketing misconduct and say, we have no control over these agents and brokers or their brokerage firms. But CMS has been pretty clear that plans are liable for the conduct of these downstream entities, he said. Medicare has told plans it will begin policing marketing materials more closely. Starting next open enrollment, Medicare will review and approve television advertisements before they air to make sure celebrities accurately describe the plan's benefit. One heavily shown ad that featured Joe Namath, the former star football quarterback, was changed to comply with regulations. According to the report, CMS remains committed to the shared goal of protecting people with Medicare from confusing and potentially misleading marketing, while also ensuring they have the accurate and necessary information to make the coverage choices that best fit their needs, said Chiquita Brooks LaShaw, the CMS administrator, in a statement thanking the committee for the report. And this, the post private Medicare plans misled customers into sign up, appeared first on the New York Times. Okay, so right now, currently, and today is the 4th of November, the Medicare enrollment period started, I believe, was October 15th, and it's going to go all the way to December 7th. And you're going to see a lot of ads on the TV about Medicare Advantage. And they're saying you have to be very careful because these people, they got a commission, you know. So they're going to be very aggressive in trying to see if they can have you sign up for Medicare Advantage. And they don't care. Like that man who went to the pharmacy and he has no coverage for medicine. I mean, come on, you know. Even if somebody's crazy, they're not going to do that. If you know you reach a certain age and you depend on certain medication, you're not going to switch plans for something where you don't have medication just to get like, I don't know, maybe $100 or $140 a month, saying you get back in your Social Security. That's the whole trick. They say they're going to give you money back, money for groceries, money for silver sneakers plan, whatever the hell that means. I believe it means like you can go to the gym, you know, if you want to go to the gym, they call it silver sneakers. All that they're giving you for free, like they're doing out with Humana. The guy, what's his name? Tony Cooper, I think his name is. Yeah, Humana, a more human approach to healthcare. That's what he ends up saying. But the thing is, you have to be alert and you have to be aware. Another thing too that's said is that with Medicare Advantage, you have to stay within the network. Their hospitals and so forth, the doctors, you can't go out of network. If you go out of network, you're on your own. You have to pay more if you go out of network. And that presents a problem. So if you go traveling and you have Medicare Advantage, and it's one of those plans where you know, you gotta be in network, then you might find yourself responsible to pay a lot of the bills if that happens. And before your doctor does anything, they gotta call them to get approval on the Medicare Advantage. However, if you stick with the regular Medicare plan, and then there are some buy-ins, I believe, like a Plan G, Plan N, stuff like that, where you can get prescription and other stuff when you pay extra. If you do that, then no, you don't need any referral. You see, you can go straight to a doctor without referral. Unlike Medicare Advantage, you need to get a referral, and your doctor has to make calls, spend time calling, or the receptionist. And good luck, you know, because they may not approve you. Another thing too, certain things they may not approve. Like if you're sick for certain things, and they say, well, you know, that's an experimental drug. We're not gonna deal with that. You know, so that means you have to die. That's what that comes down to. Whereas with original Medicare, if you're sick, you go to the hospital, they pay. But Medicare has a system set up whereby if you go to the hospital and you get sick, let's say like 3 times within the month, they're not going to pay extra. The doctors, the hospital, they're going to have to accept like a flat fee. So they have certain diagnoses whereby like certain things. If you go on there, let's say, maybe you have appendicitis or something like that, or you need surgery, there's a flat fee for that, you know. So that's it. They're gonna pay that fee unless there's something complex that comes up that has nothing to do with that per se, and then they will pay. Other than that, most of the things are set up with a certain fee, and that's it. So when you go to the hospital, if you're sick and you go there and admit it, if they send you out too early and you're sick and you have to go back to the hospital, Medicare is not going to pay anymore. They already paid. They already paid a certain fee, so it's like they have to get you out of there. It's like sitting in a restaurant in America, you know. Anybody who ever dined in an American restaurant, the waiters come around, ask you, everything okay, this and that, and they try to rush you out to get you out of there. Unlike, let's say, in France, if you go and sit in a restaurant in France, you don't get that. The waiter ain't gonna come and ask you everything is okay. No, très bien, très bien. No, you could sit there all afternoon in a restaurant in France. No waiter is gonna come up to you and try to get you to move. That's their culture. So I'm using that analogy to show in America they try to get you out fast in the restaurant, unlike in France. So in the hospital, if you're sick, they're gonna try to get you out because they get a flat rate for certain diagnosis. They go by that, the diagnosis, what it is. So they don't want you coming back sick. Of course, if you come back sick, they got no choice but to accept you if you're really sick, you see. But that's not something that they expect or want to happen. They want that when they discharge you, you're gone. You're not coming back. But if you do come back, and it's the same thing, the same diagnosis, well, it's a flat fee. That's the difference, you see. But with Medicare Advantage, if you go back, chances are they may not want to pay, or they may tell the doctor, no, we're not authorizing this, or maybe go to an urgent care center. So people have to be very, very careful. All the things they tell you about, this silver sneaker stuff where you can go to a gym and zero pay premiums, and you can get money to buy like healthy food, like a prepaid card or something. You can buy healthy food to live on, all that stuff. Yeah, but all that stuff comes at a price, because with Medicare Advantage, you sign up. I mean, some of them may have good plans, but you have to consider first, You can't just let people talk you into something. You have to look. Like they say, they use the term, the devil is in the details. You have to know the details if it's something for you. You see, you just can't take their word for it. And this article here is pointing this out, because right now on the TV, every day I turn on, I see they advertise things about Medicare Advantage, about health care, like extra dental fillings, x-rays, and this and that, like the woman calling her husband, Al, did you call this number? And he said, we got Medicare already, what we need it for, what extra? And then she calls him Alan. Instead of Al, she calls him Alan. So when a woman calls you by your full name, you're in trouble. So she calls him Alan, and then she explains in the commercial. And he said, well, extras like what? And she count them out. And you get things like dental care, x-rays, and so forth, vision, hearing. And he said, we need that. And he grabs his phone and he said, I'm calling now. You see, so those are the kind of commercials that will get you. If you just look at it, on the surface, you say, yeah, I'm going to be like Alan. I'm going to make that call that his wife told him to call. And then you may find out that maybe you don't have prescription benefit. Or, like the old lady in the rural area who she used to go to a place, a healthcare provider in her community. She lives in a rural area. And then all of a sudden she switched to a different plan and she's not covered. The place that she used to go to in her rural area isn't covered. And if you ever been out driving in rural parts of America, you can drive 100 miles away to find, to maybe find medical appointment or something. So especially for an old elderly person, that's not really right to do something like that. But these people don't care. They know once they get you, that's it. And then they have open enrollment, which is like about a whole year after, you see, between October 15th to December 7th. So they don't care. They're going to get a commission. And I think they get a commission, I believe, for maybe like 7 years. That's what I heard. So they have a nice commission coming in. So there is an incentive to get you to sign up, regardless of what it is. Or whether it works for you or not. There is an incentive because there's money involved.